Initially, I wanted to be a cardiologist in medical school. That's basically what I wanted to do. But as I started residency and actually got into the real world of taking care of patients, it seemed like, at least to me, that the practice of cardiology was more looking at numbers, looking at how the coronary arteries looked on images and all. And there seemed to be less of a focus on the patient. And that's really not what I wanted to do. Now, I hadn't decided about oncology, but during my first year in residency, I met during an oncology rotation, I met a patient who was young, like in his early 30s, I believe, and he had Hodgkin's disease, was stage 4. And he had actually been diagnosed over a year ago and went into alternative treatments and tried different approaches to treatment and did not want to go through chemotherapy and got extremely sick because things didn't work out very well. And by the time he came back for looking into treatment, he was extremely ill, very weak. His spleen was very enlarged. And so he looked like he was not going to make it very long. And he was started on chemotherapy, and then I forgot about it because I changed rotations. A couple of years later, I did another oncology rotation with the same oncologist, and I met this guy again. And I didn't initially, when I saw him, I didn't realize that it was the same patient, but he looked perfectly normal. After I talked to him, I figured out he's the same guy that I had seen, and he was working full time and basically normal. He had been cured, or at least was in remission at that point. And so that seemed to affect my decision about going into oncology, because I saw like how big a difference the treatments could make. And that was, I think, really the changing point where I decided that oncology was what I wanted to do.